Now, did you know that without antibiotics, all those surgeries that we are going through will not be possible? Did you know that? Did you also know without antibiotics, even a basic and an emergency surgery like a CS will not be possible? Did you know things like dialysis, invasive things like dialysis, procedures like dialysis, surgeries like kidney transplant, the prostate will not be possible? Did you know that? Did you know that if at all we had resistance to near all antibiotics, did you know you will even get afraid of just toppling and falling? Because if you get that wound, is a problem. So on this platform, everything that we do, we encourage you to fix your immunity through dietary modifications, through fasting, as we are doing right now. So that is what we do for a living. But above all, we understand that this information can only reach 1% of the population. And even though it reaches 1% of the population, we will still have people in that healthy population who will still need antibiotics. Remember, people who are immunocompromised, like the HIV patients, like the cancer patients who are on chemotherapy, they need antibiotics so that they can actually, the antibiotic can actually help or assist the immune system to fight infections. People who are diabetic, their immunity is going down. So if you fight diabetes and if you overcome the diabetic menace, you are at a very good place in terms of antibiotics therapies, because one, you will not need them, and number two, if you need them, it will be totally necessary. So therefore, you'll end up avoiding the side effects of antibiotics therapy. We are going to discuss these things. We're also going to talk about how agriculture and the food industry have incorporated antibiotics in their products, and now it's becoming a serious problem. Okay, that beef, that chicken that we eat all the time, that rotates in a mirror. Okay, you know that chicken that rotates in a mirror? Those chicken are fed on antibiotics. How did they end up being fed on antibiotics? Are the antibiotics that are used in animals the same antibiotics used in human beings? Are they? Now, what is an antibiotic? Anytime we talk about antibiotics, people start to think that these are basically antibacterial agents. So you're thinking amoxicillin, you're thinking azithromycin, you're thinking any penicillin that comes into your head. So when I talk about antibiotics, bio means life. So which means antifungals are antibiotics. Hello? Those of you who still think that antibiotics is basically those drugs that act against bacteria. No, that's an antibacterial agent. Antimicrobials and antibiotics and chemotherapy are sometimes interchangeable, because bio means life. So when you say anti-bio, you mean anti-life. So therefore, an antifungal is an antibiotic. So an antibiotic is basically a substance that is actually, it has to be chemical substance that actually acts against the life of a microorganism. When you talk about stewardship, we're actually talking about programs that advocate for appropriate dosaging in form of antimicrobials. Please don't confuse that. When I'm saying antimicrobials, I'm saying like literally all, including antifungals. So when you're talking about antimicrobial stewardship, stewardship is just goodwill, just making sure that the information that is right about this medication is actually put out there. So one, appropriate drugs for appropriate conditions. How many of you have gone to the chemist and requested to be given a whole dose of amoxicillin for a common cold? And you tell that gentleman, if I have these chest pains, I know this is just pneumonia. I know I'm not coughing, but when I feel some pain here, I know that is my pneumonia. Now it's your pneumonia. So I know this is my pneumonia coming. So please give me the amoxicillin dose. And nowadays in the chemist, amoxicillin is being sold. Okay, let me just use the word amoxil. Amoxil is being sold. At least 5 capsules are being sold for amoxil. So now, and if you don't sell them, somebody else will sell them, because people are in business. They have to pay bills, right? So if you don't sell them at 5 shillings, somebody is selling them. If you don't sell them at 50 bob, somebody comes and tells a pharmacist or a pharmaceutical technologist that I need 10 tablets. I'm amoxicillin 50. I need amoxicillin worth 50 shillings. And you see, antibiotics are not supposed to be dispensed just like that. They are not over-the-counter medication. They're supposed to be prescription-only medication, regardless of the antibiotic that you're using. So you buy an antibiotic for 50 shillings, you go and take it, and most of you don't even know metronidazole, aka Flagyl, is actually an antibiotic. Because just remember, it's antibio. So it's acting against living, against life. And of course, amoeba is a microorganism. So Flagyl or metronidazole acts against amoeba. So that's an antibiotic. But you see, the reality is this. How many of you have taken metronidazole dose to completion? 5 days. How many of you? Somebody is saying in Africa is not like that. It is sold over the counter. Yes, most countries in Africa sell antibiotics or antimicrobials over the counter. So my question is, how many of you have suffered a stomach upset, went to the pharmacy, bought metronidazole dose for 5 days, those 15 tablets, or those 30 tablets, and then you've taken them completely. You've swallowed them for 5 days. Complete. How many? Very few people will take those medications for a whole dose and clear the dose. But you see, antibiotics, when they are prescribed for 5 days, you need to take them for 5 days. And there is a reason. And I saw, what is his name? Is Doctor Who? Is it Nganga also on TikTok? He was actually trying to educate you guys about, those guys on TikTok, about the frequency of taking medication. I think most pharmacists and pharmaceutical technologists have become reluctant on this one. That when you're told 1 times 3, we have actually become a 1 times 3 people. 2 times 3, 1 times 3. If you're told 1 times 3, you go and take the drug in the morning, at lunch hour, and in the evening. That was not the essence of that incomplete sum. Yes, that incomplete sum on that envelope, it was not designed to be that way. 1 times 3 is supposed to mean you're taking that tablet every after 8 hours, so 8 hourly. So simply divide your day into 3. That means you take it every after 8 hours, and your day, you combine the day plus night. It's about the 24 hours, not about the 12 hours only. So for you guys, you divide the drug, the day into 12 hours. Then you use those 12 hours and divide by 3. And you don't even divide completely. What you do is you decide, I'll take this at 7 in the morning, at 1, and at 5 in the evening, or 7 in the evening. That's a mess. And that's why these drugs are becoming actually resistant. When you're told 1 times 4, basically that antibiotic that is called flucloxacillin that is used for the wounds, most people take 1 times 4 as it's written there. So you divide your 12 hours into 4 times. So you take it every after 2 hours, like literally. No, it's supposed to be taken every after 6 hours. And there is a reason behind that. And this is the reason. When you take any drug, that drug is absorbed. Okay? Have you ever asked yourself why you take paracetamol, it goes to the stomach, but then heals the headache? Why don't we sniff paracetamol? Why don't you make powder and just sniff it direct into the head? It's because it has to go to the stomach, and then you absorb it. It goes to the liver, it is activated, and then from the liver, it's now sent into the stream, into the bloodstream, into the circulation. And when it gets into the circulation, now it goes and attaches to receptors. That is me giving you mode of action of drugs. So you swallow it through the mouth, it goes into the stomach, it is dissolved in the fluids of the stomach, and that is where the problem comes in. You see, before I even go to the entire process, let me just educate you a little bit about the stomach. That stomach acid there is designed to make sure that that drug dissolves in it so that it can be easily absorbed. So the drug has to dissociate. And you see that paracetamol that dissolves in water and just the effervescent tablets, they have actually helped you to dissociate that tablet using water so that it gets into the stomach so fast, it's absorbed quicker, and gives you action faster. Okay. So what happens is in the stomach, it has to dissolve. So it disintegrates and then dissolves, and then now it is absorbed. And then it's carried all the way to the liver. And in the liver decides, where do we take this one? Do we clear him or do we activate him? And then do we send him into the bloodstream? So when the liver decides to send the drug into the bloodstream, the drug gets to interact with something called receptors. When it binds to those receptors, now it gives you an action. The headache disappears now. You see, that's a very long process. So the headache disappears. And that's how the drugs work. So if you have a drug that is formulated as a capsule, That capsule is intended to make sure that this drug resists stomach acid. That this drug is supposed to be deposited possibly in the small intestines. So that capsule is there to make sure that the drug does not get destroyed by the stomach acid, so that the capsule goes beyond the stomach acid, and when it gets into the basic environment, it can release the drug towards the small intestines. And now you absorb it directly into the small intestines. This goes to those people who are fond of separating the amoxicillin capsule and you drink the powder. Okay, there are those people who separate the capsule and then now you take the powder because you want the action to be very fast. You're so impatient. Hauna subra. So you separate the capsule and you drink the powder and quickly you flush with water. And now you're telling people, yeah, I am a strong man because I can take a very bitter powder of amoxicillin. You wasted that amoxicillin. You wasted it because that capsule is designed to make sure that it delivers that drug. Because remember, there's a difference between a medicine and a drug. A medicine is when you see paracetamol, the tablet, that is a medicine. What you're seeing is a tablet, and that tablet is not 500 milligrams because paracetamol tablet is supposed to be 500 milligrams. But that tablet is not 500 milligrams, is more than that. The active ingredient in this medicine is what we call a drug. So, for example, if you have paracetamol 500 milligrams, we take that powder of paracetamol 500 milligrams, we give it diluents, we give it binders, we give it preservatives and all that, and then now we make a tablet out of that. So that tablet, of course, it can weigh about 1.2 grams, right? But 500 milligrams of that 1.2 grams is paracetamol. So the remaining is actually the excipients. We call them excipients. This is the difference between the original drugs and the generic drugs. So you've taken a drug, and this basically you've taken a tablet. That is a medicine. That tablet goes into the stomach. It dissociates. So you don't absorb the excipients. The basically excipients, the good word or the appropriate name for the excipients is the ingredients. Okay? So we have the active drug and then we have the ingredients. So these ingredients dissociate in your stomach acid and then they release the drug. Once they release the drug, what you absorb into the bloodstream is the drug, the active drug, not the excipients. Then this drug is carried from the gut or from the stomach all the way to the liver for activation. Because as it's carried there, it can be inactive, it can be more toxic, it can be less active. So the liver decides, can I make this one more active? Can I make them less active? Can I make them water soluble? Can I make them fat soluble? If I make it water soluble, it's cleared through urine. If I make it fat soluble, it remains in the system. Put that aside. So this medicine that you've taken, that paracetamol tablet, inside that tablet, we have 500 milligrams of a powder that is active paracetamol. But the paracetamol tablet, if you weigh it, it's more than 500 milligrams. Why? Because there are other ingredients that actually make the tablet. Okay? So if I have a capsule that has, let's say, doxycycline, 100 milligrams, that means this capsule weighs more than 100 milligrams. But the powder that is inside, the active ingredient is actually 100 milligrams. So the difference between original and generic drugs, this is the difference. It is not like generic drugs are the fake drugs. No, that's the wrong way to interpret it. Generic drugs, let me start with the original ones. So you see, if I'm designing a drug to treat a certain condition, I will have to invest in this process, the process of manufacture, the process of all those things, the production cost. I will incur it myself, including the research. That's why it takes 8 to 15 years for you to develop a new drug. Imagine that, 8 to 15 years for a pharmaceutical company to come up with a new drug for one condition. 8 to 15 years. How long did it take that pharmaceutical company to make COVID vaccines? Hello? How long did it take that COVID vaccine to be manufactured? Those of you who remember, I always use that as a focal point because I know what I'm talking about. So it takes 8 to 15 years for you to come up with a new drug. So if I'm the one who is designing this new drug, what I'm doing is I'm actually investing in research, I'm investing in resources to make sure that I come up with this new drug. And then I invest in clinical trials and all that so that I make sure that this drug is safe for both those people who are healthy and those who are sick. That's a long process. Now, once that drug has been approved by legal authorities, now that drug can be released in the markets after the clinical trials. Now, what does that mean? That means I've spent a lot of money to just come up with that new drug, and then I call it my name. Let's say I call it Lewis tablets. That Lewis tablet is what is an original drug because it has been done research. It has been actually researched appropriately and maximally. We have done preclinical trials. We have done clinical trials and all that. Now we need this drug to be released in the market. When we release that drug in the market, there's something called patents. So I have to patent that drug. And I'm given about 25 years of patency. So that means nobody else can make a drug called Lewis apart from me and my company. That's an original drug. Now, after these 25 years have elapsed, what happens is, of course, there are people who cannot afford the original drug. It's very expensive because I'm actually recovering my cost of production and my research and my money. I have to return that money and then I have to make profits from that drug. Have you understood that? So that is the original one. But after the 25 years have elapsed, they actually is assumed that I've made all the profits that or the cost that I incurred to produce that new drug. So now I can release the formula to other people. So if you have your pharmaceutical company, I can give you that formula and tell you now this is the formula for making Lewis drug, Lewis tablets. Now use that formula to make cheaper alternatives. This is like China. Here is the Samsung phones. But you can make other forms of Samsung phones that are affordable so that everybody can have a Samsung phone. So that nobody complains that Samsung is for the rich. No. All of you can have vehicles. These are a Toyota vehicle. But because you cannot afford a Toyota, maybe Prado, this is still a Toyota. You can still drive. You can still be called a driver. You can still stand or park in a petrol station and fuel that vehicle, and you chest yourself and say, I have a vehicle. So you can be counted in those people who have vehicles. Even if you call it a Kadudu, it's a Kadudu. You still have a vehicle and it's Toyota. So that's what happens. So now I give out the rights for other people to use my formula to actually make more drugs or new drugs. When that happens, every other person, because of business, they are running to take that formula and make their own drug. Take that formula and make their own drug. Now, the reality is, some of these companies will use very, very substandard ingredients. The drug will be the same. Paracetamol tablet will be the same. It will be the same. 500 milligrams of paracetamol tablet. But the ingredients that will be used to form these other drugs is the difference. Because I don't want to share my ingredients. I have shared the paracetamol, the formula. It's now up to you to start making your own ingredients and make sure that this one conforms to the standards of, they call it the British formulary. Okay, so that's how drugs are designed. So those generic drugs are not fake as such. But of course, the excipients that are used to make sure that you have this now Lewis tablet, which is a generic tablet, can be, of course, substandard. But that is not the same to counterfeit drugs. Counterfeit drugs are basically somebody lying to you that this is a drug that is paracetamol. It has Lewis inside, but it's not Lewis. Okay? Yeah, I've seen people sitting in a room and packaging unga, maize flour, into capsules and then selling it as though it's amoxicillin capsules. Yes, there are people who package different substances in capsules and then they sell it out as antibiotics. And you buy them, you guys. You buy them. That pharmacy that is near you and is not licensed is actually selling you counterfeit products. Those drugs that are crossing borders, the porous borders from other countries inside, and the pharmaceutical regulation bodies are, of course, silent about it because of the money. What is the difference between UK and India drugs? Very good question. There's no difference. Drugs are drugs. But the point is this, the same thing that I'm saying, counterfeits, one, and generic. India is the #1 producer of generic drugs. I really wonder why Everybody is interested in medication from India. Everybody. And actually in Kenya, I think Kenyan companies for pharmaceuticals are very few. Good. Anyway, back to the antimicrobial stewardship. So what is resistance? Resistance means this. Listen, I told you for a drug to be produced by a pharmaceutical company, we need 8 to 15 years of production. But microorganisms are actually mutating every after 20 minutes to 1 hour. So imagine that. If microorganisms are mutating every 20 minutes to 1 hour, and you need 8 to 15 years to make a drug, imagine if we have drug resistance. Imagine if we have drugs that are not active against these microorganisms. How are we going to survive? Now remember this. Surgeries depend on antibiotics for prophylaxis, prevention of infections. Remember, your skin has a lot of infections. So if you get a cut and your immunity is low, that means all these microorganisms on this skin will get into that wound and you'll get infected. That is what we call the sepsis. When it gets into the system, you get sepsis. If you get antibiotic resistance, surgeries will not be done. A simple boil will finish you totally. We will not do surgeries like CS. We will not do things like dialysis. Imagine that. We will not be able to treat infections. And when I say to treat infections, I'm saying bacterial infections. Listen, I know that you've gone to hospital someday and you've been told you have blood infection. And then you put on several antibiotics. That is actually one of the reasons why we are having all this antibacterial or antibiotic resistance. Because we are told you have a blood infection and nobody tells you which blood infection. When a doctor says you have blood infection, ask them which one. So when you keep on abusing that antibiotic, what will happen is, remember these microbes are actively mutating. So what is going to come up is, as they mutate, they are resisting those drugs. And you see, the problem with the general public is you are so smart. Google has made you doctors. So you're Google doctors. So you go to a doctor and tell them, I need the original drug. And now the doctor writes the original drug. And you give this to your babies. What you don't know is most of these antibiotics are broad spectrum. It means they actually act on all the microorganisms, regardless of the type, whether they are good or bad. They kill them all. Once they kill them all, those microorganisms that line your gut are actually your first layer of immunity. So you destroy your immunity. That's why after antibiotic therapy, chances of you getting a diarrhea are very high. And that's the reason why you take a pre or probiotic after antibiotic therapy. So it's always necessary to take these fermented cabbages after antibiotic therapy, even if it's 5 days, so that you replenish the gut microorganisms so that you don't get diarrhea and you start boosting your immunity. Also remember, the antibacterial agents, the drugs were not brought in to help you heal. They were brought in to lower the bacterial load or the microorganism load to a certain level so that your immunity takes over. But the problem with you people is you are Google doctors. And again, you eat a very unhealthy food. So your immunity is already compromised, but you still think that drugs will come in to change your situation. Drugs cannot change your situation. What happens is they're supposed to just lower the burden and then your immunity takes over. So the problem is you still weaken your immunity through foods. How many of you carry juices and fruits and honey and margarine and bread and sugar and pasteurized milk and ferry them to the hospital beds, to the wards, to give your fathers, to give your relatives and your friends who are there? How many of you do that? You make all these foods, the chapatis, and you take them to hospital. Of course, you're doing it with goodwill, but you don't have the information that you're actually lowering their immunity. So you're actually going to make them stay in the hospital for long times. Yes, even chips. So people are taking French fries to patients in the hospitals. And then you give them the Lucozeds and the Ribanas and all that because you want them to get energy and boost blood and all that. And you just don't have the information. So all of you are in front of that. You carry those rose flowers to the sick person who has just come from theater and with the very good GMO bananas and the pineapples and the yogurts and the cakes. Then you put them there. This person is, oh, these guys love me. But one, that is fake love because you only show that love because they are sick. You only showed concern because they became sick. If they did not become sick, you would buy those cakes and eat them. You would not ferry them to them. That is one. Number two, you're taking their wrong foods. So you're actually telling them, bro, I want you to think I love you, but I want you to stay in the hospital for a lifetime. So you walk one step ahead and three backwards. Pana. You need the information so that you do the right thing. If you have to carry fruits, carry avocados there. Take meat to them. Take them the liver. Ferry them some fermented milk, which is not boiled. Okay? Give them eggs. But of course, the sick people will also tell you, I don't feel like eating eggs because they give me nausea. I just want soda. When I take soda, I'm okay.